There's a lot said about amalgam fillings in the popular press, and it's one of the questions I often get asked by patients. Should I keep my amalgam fillings? Should I have my amalgam fillings replaced? Basically, there's three issues that seem to come up all the time, and let's just cover those very quickly. First one is toxicity. Amalgam is black, it's got mercury in it, and mercury's got a bad reputation as being toxic, but it is a naturally occurring element. The white fillings, which are the composites, which are used as well, there's some questions about their toxicity. So the amount of mercury that you get from fillings is so little, as most people consider it to be not a safety issue. The other thing is colour, and of course composite fillings win hands down because they're tooth coloured. The third thing that comes up is how long do they last? Well, amalgam fillings probably last longer than composites. The problem is when you prepare the tooth to place an amalgam filling, you often remove quite a bit of tooth structure, and that weakens the tooth. And because we live so long, whereas our parents and our grandparents, they used to lose their teeth and have dentures put in, our teeth have to survive maybe up to 110. So therefore, amalgam fillings, the problem is that the cavity preparation is too destructive. The question of replacing amalgam fillings is an important one because that's what a lot of people say. Once the amalgam filling is in, as long as it's been done correctly, it's probably best to leave it in because the damage has already been done. And if you're going to replace an amalgam filling with a composite, you may not be solving the problem. You're not. The only way that you can make the tooth stronger is to take the amalgam filling out and put in an indirect restoration. When you make an indirect restoration, because it doesn't flex, you can actually get the patient biting on the middle of their tooth again. And the porcelain or the gold is not going to flex and cause pain, it's going to take the load. And that's where you want to be biting on the tooth. Not on the outside, which is going to flex, you want to be biting in the middle fossa, where it's designed to take the load. So, in other words, simply, should you replace amalgam fillings? Probably, if you're getting symptoms. If the tooth is showing signs of cracking and the tooth is at risk of fracturing. A lot of root canal treatments are done on teeth with cracks in, and because the crack continues to open up, bacteria get in through the crack, and so the root canal treatment fails. Even if you put a crown on the tooth to try and hold the tooth together, the crack can still open up, and the tooth can eventually split over a number of decades, and the tooth can be lost. What you want to do is you want to see a dentist where there's a range of treatments offered to you, and you should always ask when you see a dentist which treatment is more suitable for you. And sometimes it comes down to cost, sometimes it comes down to a whole lot of other issues. So each case has to be decided on its merits.